Hello, Dr. Stephanie Gray from Integrative Health and Hormone Clinic and Your Longevity Blueprint. Today I want to start with part one of a two-part video series on hypothyroidism. So have you ever wondered if symptoms you're experiencing could be due to a poorly functioning thyroid gland? Well, you may be right. You could be in the up to 60% of individuals with thyroid disease who are actually unaware or undiagnosed of this condition. So let's start with discussing how your thyroid helps you. In Chapter 6 of my book, Your Longevity Blueprint, I discuss how important thyroid hormones really are. They help with metabolism, energy, and even memory. So symptoms of low thyroid include cold intolerance, fatigue, sluggish metabolism or inability to lose weight, sluggish bowels like constipation, poor memory, dry skin, even swollen tongue. Think about everything just kind of slowing down. So how would you know if you had low thyroid? Obviously examine your symptoms, but also have your provider check your thyroid levels, not just TSH. So TSH stands for thyroid stimulating hormone, but this is a pituitary hormone, not a thyroid hormone. It's currently the most common screening test for thyroid disease. However, many clinicians feel this marker is not quite sensitive enough. For instance, many of my patients have come to see me after years of being told their TSH levels are normal, yet when we actually check the functional levels, the free T4 and the free T3, these are low or barely in the reference range. So those patients have been left untreated when they likely could benefit from treatment. And as one of my mentors, Dr. Joseph Collins, once told me, TSH stands for too slow to help, because by the time TSH is high, many patients have had low thyroid symptoms for a long time. So TSH may not be the best test because, again, it's that feedback mechanism from the brain. But think about it, if that feedback mechanism isn't perfect, then maybe the signal that's being sent isn't quite accurate. So if the signal is correct, the higher the TSH is, the more the body is unsatisfied with circulating thyroid hormone levels. It's screaming for help. It's calling for more T4 and T3. But actually, I've seen patients with perfectly normal TSH levels, yet again, low free T3 and free T4 levels. So some believe also TSH is too lax, considering that when normal was created, it included testing results on elderly patients and those with poor thyroid function. So regardless of what your local lab may use for standard reference range, according to the American College of Endocrinology, TSH levels should be between 0.3 and 3.0. And many functional medicine providers actually want, or they aim to keep TSH below 2. Now, in order to not miss thyroid conditions, TSH should be checked, but additional labs should also be checked, like what I mentioned, the free T4 and the free T3. Those are the body's main thyroid hormone levels. They're made by the thyrocytes, the thyroid cells in the thyroid gland. So T4 is made by thyroglobulin joining up with 4 molecules of iodine and T3 with 3. It's then taken up by thyroid binding protein. Now the liver is going to convert some of the T4 to T3 while other tissues convert the rest. And many of my patients have what's called poor T4 to T3 conversion. Now free T3 is about 3 times as potent as T4, and your body only has T3 receptors. And this means you could have very high T4 levels, looking like your T4 is amazing. But if you're not having your free T3 checked, if it's not converting to T3, that signal or that message isn't getting sent. So having that higher T4 could virtually be useless for you. So many of my patients have problems with a T4 to T3 conversion, and I will discuss further about what you can do to improve this in part 2 of this video series. This is also why patients could have normal TSH, normal free T4, and still be symptomatic of low thyroid because they're not converting T4 to T3. Also, some T4 can convert to what's called reverse T3. So think of T3 as the gas pedal on your metabolism, right? Reverse T3 is the brake. So you don't want your brake on and your gas pedal off. Reverse T3 is high in times of stress, surgery, trauma, and chronic illnesses. So you should have your thyroid hormone levels checked, your free T4, your free T3, and even your reverse T3. Now in other videos I've done, I've mentioned how stress is your body's biggest hormone hijacker. And so that again is why your body could be converting T4 to reverse T3, stress, and not to T3, right? It could be converting that T4 to your brake pedal, not to the gas on your metabolism and energy. And lastly, have your thyroid antibodies checked. So these will show if you have an autoimmune thyroid condition like Hashimoto's, which can lead to low thyroid. Now, if you have elevated thyroid antibodies. This means your body's literally attacking your thyroid gland, and eventually thyroid function will go down and you could become more symptomatic. So in conclusion, pay attention to your symptoms and have your provider comprehensively check your thyroid hormone levels, because you don't have to suffer. Find a provider who can get you appropriately treated, and tune in to part 2 of this video series on what changes you can make with diet and supplementation to improve your thyroid function. Now you can learn more about hypothyroidism and what you can do to prevent the progression of even autoimmune diseases like Hashimoto's in my book, Your Longevity Blueprint, Chapter 6. So thank you for tuning in. Please share this video and this knowledge with friends and family. I'd love to hear feedback, and leave me a comment if you have any questions. Please like and subscribe to our new YouTube channel, and remember that wellness is waiting.